I just got back from Panama for the ICHRS meeting, and probably one of the most fascinating, if not the most fascinating lecture I heard was by Marie Schambach on current management strategies she's using, and she's publishing, I noticed this month in November, on management of trichotillomania. For those that don't know what trichotillomania is a condition where you have a obsessive compulsive disorder to pull out your own hair. So you can have patches of hair loss, maybe eyebrows, eyelashes, ear hairs, scalp hairs, and usually it spares the frontal scalp, the border, because it's too painful to remove hairs there. And there's an area that has hair loss behind it. Now, I have done transplants in patients with trichotillomania, but the patients must be on usually SSRIs, selective serotonin reuptake inhibitors, which are for like antidepressant, helps control their OCD issues, and also obviously must be stable for a long time and under psychotherapy for this, to make sure that I don't transplant that and then it comes back, the condition comes back, and then all the hairs I transplant are then plucked out. The new strategy that I heard from Marie is that it's actually using a micro roller. It's a 0.5 millimeter micro roller. So it's something that you can get over the counter. It's just basically a little roller that has little needles on it. And some people use it to stimulate the scalp for hair growth, to help minoxidil have better penetration, or a topical finasteride. But in this case, what it's doing, it's a type of behavioral therapy. For example, you could be snapping a rubber band on your wrist to simulate the nervous behavior. But in this case, it actually simulates the feeling of hair being pulled out. And so what's interesting is that it's actually stimulating hair growth, or at least not causing hair loss, at the same time creating a feeling of sensation of hair pulling. And it's the most direct way of actually feeling like hair is being pulled out. So what's really cool is that it's actually helping you, and I think people combine it with the minoxidil topical to allow minoxidil to help hairs grow there as well. At the same time, they're using the microneedle. And in Marie's study over a year, she found that there was only one, I think she had 4 cases, one had a relapse at 8 months, and the reason is that the woman forgot to bring her micro roller with her on her vacation and then plucked all her hairs out. So to me, this is a huge breakthrough in terms of management that could be very effective.